Good morning, good morning, good morning, everyone. Thank you for joining us today for our first day of webinar presentations. My name is Dr. Tashina Reeder, and I am the director of the Community Health Training Alliance. And we're really excited to present to you again this year for the second year our virtual HIV and Prevention and Education Summit. Today, we will be talking about taking on the challenge of stigma presented by Blake Rowley. Before we get into today's presentation, I just want to offer you some reminders of in preparation for today's presentation. So the chat has been disabled, but you can ask all of your questions and the Q&A box at the bottom of your screen. At the end of today's presentation, we'll answer your questions accordingly as they come into the Q&A box. And also, before you leave or we end today's session, you will be prompted to complete a survey. We really want to hear from you and get your feedback about today's presentation. And so without further ado, I'm going to turn this over to Blake Rowley.
Hi, thank you so much for that, Dr. Reeder. Again, my name is Blake Riley. I'm the community liaison with Gilead Sciences, and it's really a pleasure to be able to be with you for the second year in a row to have this, what I feel is a really important conversation and discussion regarding taking on the challenge of stigma. Give me 2 seconds to share my screen, and we will then get started once everything gets pulled up. All right. So today we're going to talk a bit about taking on the challenge of stigma. And this is something that many of us who are people of who are LGBTQ, who are of different identities that are not cisgender or white, or people who are living with HIV or any other STI, or who are at risk for HIV, experience either on a daily basis. We experience this with our colleagues, with our community, with our clients in any number of ways. And it really is incumbent on us to figure out how do we, as a community, really move forward with figuring out how do we dismantle stigma and the many forms that it occurs in for individuals, and how do we support people in achieving the best health outcomes. Just to level set and talk through some of the objectives for today, we're going to define and discuss some of the different forms of stigma and its potential impact on people. Some of these definitions may seem rudimentary. I don't want to make you think that these are the end all be all definitions. These are the definitions that we've come up with. And I would love to hear some of your definitions, either as we do this virtually or as we get back into the real world. And hopefully I'm able to see some of you in person really soon. I'd love to have a deeper conversation with you about stigma and how it's impacted people you've seen and how it continues to impact our community. We'll talk a bit about some of the stigma surrounding sex, HIV, and pre-exposure prophylaxis. Just to lean into PrEP for a second, many people are still unaware that people who are either at risk for HIV or who are utilizing PrEP do experience a form of stigma. It's no greater or less than, I don't want to play oppression Olympics around the types of stigma people experience, but stigma related to PrEP has been one of the major barriers preventing people from using PrEP. And so it's important that we figure out how do we have a healthy discussion about sex, about HIV, about PrEP use, and what that means for people. We'll talk through some actions that can be taken to cope with stigma on a personal level, but also really importantly on an institutional level. Many of us work, live, grow, and play in places that continue to support systems where we as people, for either our sexual identities or our racial and ethnic identities or our gender identities, are not fully supported. And the institutions in some of these places continue to kind of really support those stigmas. And it's important that we think through how do we dismantle that, but also really key to that is thinking through how do we do that in a safe way. Lastly, we'll provide some online resources about stigma and its intersection with sexual health and mental health, as well as with substance use. So just to define some things really quickly, what is stigma? We define stigma as a mark of shame or disgrace that's attached to something regarded as socially unacceptable. Many of us, as I said, experience stigma for a number of different reasons in our lives. It could be because you're short. It could be because you're a larger person. It could be because you're Black. Anything that, really the normative group in society has kind of defined as socially unacceptable, it has been given a mark of shame to someone else. It results from negative and really often unfair beliefs that lead to discrimination. And people who are stigmatized are seen as being different, and really importantly, blamed for that difference. When we think about things like people who are living with HIV, in many ways, people who are living with HIV are blamed for having HIV. When we think about people who are LGBTQ or anywhere on the spectrum of a gender identity, as we've grown up, many people in our lives have thought that those are characteristics of people that are changeable. And because you are able to change it, it is something that we can blame you for. And what it eventually and ultimately does is divides people between us and them. And if I'm in the us in group and you're in the them or the them out group, I then get to do certain things to you that are not helpful, that are stigmatizing, and I get to classify you in very different ways. Who's affected by stigma? The truth of the matter is, if you are a person living this life and in this world, you are affected by stigma. Many people experience stigma related to health conditions such as cancer, obesity, mental illness, or HIV. People who are living with, say, lung cancer, who are smokers. Again, to go back to blaming people, we blame them for having lung cancer, and we conversely treat them differently. We talk about them differently. And that stigma is not helpful for them. It's not helpful for helping people try to figure out, how do I reduce smoking or engage in smoking cessation. People who are, living with HIV or mental illnesses, we again blame people for those things that are probably sometimes not in their control. People are also experiencing stigma related to their identities, such as race, ethnicity, gender, or sexual orientation. Many of us, I'm sure all of us, are probably very familiar with a number of stories related to people who've experienced stigma, particularly related to race, ethnicity, or gender, or sexual orientation, and continue to do that. We have people come into our clinics, into our hospitals, into our CBOs every day who are experiencing a stigma related to something like this. And then lastly, people who are engaging in certain behaviors or experiences like substance use or sex work are also experiencing stigma. One of the important things I really want to share with you is this idea of intersectional stigma. If you are someone who has multiple identities, particularly multiple devalued identities, it is very possible that you are also experiencing what we consider intersectional stigma. And it's the idea that one or more or two or more of your identities are converging and also being devalued at the same time. Stigma takes many different forms. The first we'll sort of lean into is this idea of internal stigma, which is really shame that people may feel about themselves that prevents them from taking steps to talk about their experiences or to seek help. It's also called felt stigma or self-stigmatization, and we'll talk about this a little bit deeper in just a moment. The other form of stigma that can be taken is external stigma, and this is really the unfair and unjust treatment that we experience from other people, right? It's when people do things to us, they harm our bodies, they harm our mental or physical space, and this is called enacted stigma, or a term we're probably more familiar with, discrimination. As we think about internal stigma, it's really going inside of ourselves and thinking about the painful displays of stigma that people experience, and taking on the idea that we believe them about ourselves, right? That if I, as a Black queer man, am experiencing multiple stigmas related to any of those identities, the idea of internal stigma is that I believe what people say to me about those identities, that because I am Black, I am less deserving of X, or because I am gay, I am supposed to have X, Y, and Z, or I will ultimately, be someone who's living with HIV, that these things are supposed to come to me. And this internal stigma leads to things like shame, isolation, despair, fear of being discriminated against and judged negatively, right? So ultimately, this internal stigma begins to impact my mental health and my physical health in very real ways. Me believing the things that the world says about me ultimately impacts how I feel about me, and prevents me, sets up barriers for me to seek the care that I need. The negative feelings linked to internal stigma can keep people from taking these steps to talk about their health, to protect their sexual health. We lean a lot into sexual health because that's sort of our bailiwick, but we also want to make sure that we have conversations about mental health, because mental health is sexual health, physical health is sexual health. All of these things really converge. And it's important that as we talk about internal stigma and as we dismantle the internal stigmas that people are experiencing, we provide them with the tools and resources to really talk through their health in a robust and comprehensive way. When we think about external stigma, it's really discrimination resulting from negative attitudes or beliefs. And it comes in a couple different forms. One is public stigma. And so these are the negative attitudes from the general public or community. And the other is institutional stigma. And this refers to organizations, policies, or culture of negative attitudes or beliefs. Institutional stigma, however, is not just relegated to a single organization, right? We live in a world where there are many institutional stigmas and many institutional barriers that prevent any of us from accessing the things that we need to live our best lives. And so public stigma and institutional stigma are sometimes called structural stigma. And it's really these deeply rooted structures in society, such as our laws, our legal systems, the way in which people are treated by those who are there to serve and protect us, as well as people who are in our healthcare system. It's really those things that create huge gaps and disparities between people and having great health outcomes. We know how stigma can be very harmful, right? It can have damaging effects in terms of resulting in hardship or suffering. It definitely impacts people's physical and emotional well-being and has many negative consequences, including depression, anxiety. Many of us may experience external stigma and engage in some activities that are not the best for our physical or emotional health. And it's harmful because it otherizes people. And by otherizing people, we oppress them. And anybody who is oppressed, anybody who's experienced this knows exactly what I'm talking about. It puts up barriers that weaken our ability to take care of ourselves and ultimately leads to discrimination, as we've talked about, based on real statuses or perceived statuses. Some of the harmful effects of this can include a lack of understanding by family, friends, or coworkers. When we think about the early days of the HIV epidemic, stigma was really harmful for many of those people, particularly engaging with family, friends, and coworkers, because people just didn't quite have the information or the language. And so, for example, if you're a person who's living with HIV, particularly in the early 80s or 90s, you may have had the experience of trying to eat a family dinner and being served paper or plastic plates because people were unsure of how HIV was passed. People were also stigmatizing you because they didn't quite want you to have the same things that they had. They didn't want you to eat off their plate or eat with them. It also leads to this idea that believing that success is impossible or things will never improve. The more barriers that are put up in a person's life, the more difficult and more challenging it is for people to really overcome those. And it quickly can lead people to a place to say that I will never have, or I should never have, because I am this thing. And the world is telling me that success for me is impossible. There are many examples in many of our lives where we have seen that is not true. And it's important that we lift up those examples to show people who are experiencing multiple and intersectional layers of stigma that success is possible, that you can be a person of trans experience who's living with HIV, who was formerly engaged in sex work and still get a doctorate. Like, you can be successful, you can still be an actor, an actress, whatever it is that you want to do. We have to figure out how we actualize success and wealth for people. It also leads to fewer opportunities for work, school, or social activities. We know that particularly for our trans brothers and sisters, that work in education is a place where statistically they have lower outcomes. And so it's important that we figure out, how do we support these individuals? How do we create systems that make it equitable for all people, regardless of where your gender identity is or your socioeconomic status, for you to be successful in whatever it is that you want to do? It leads to bullying, physical violence, or harassment. We've seen just this year rises in Asian hate crimes because of what people believe about people of Asian descent. So we know that stigma and how people think about other groups, other ethnic groups, or other gender identities leads to some physical violence or harassment, and in some cases, death. It leads to trouble finding housing. And then lastly, being treated really poorly in healthcare settings. This idea that you don't deserve high quality healthcare because you maybe can't afford the best healthcare, or because you come from a certain place. And so our healthcare institutions don't always support all of us in the ways that they need to, particularly if you are someone who is not cisgender and white or male. And so, again, this intersectional stigma is compounded for many of us who are experiencing multiple devalued identities and are expressing those identities at the same time. That things are really converging for us. And so, if you are someone who is having a mental illness and also using substances, it's really easy to walk into a space and the healthcare system not really respect you because they believe that you're supposed to change those things. The truth of the matter is it's our job as healthcare institutions and people who provide high quality healthcare to really ensure that we create the system for that person to come in and get the things that they need. How is sex stigmatized? So just to go back, I mean, most of us weren't here at the beginning of time, but sex has been stigmatized since sex has been happening. So this slide says it's attached to people whose sexual orientation is not heterosexual, such as men who have sex with men. But the truth of the matter is, for anybody having sex, having a conversation about sex is often very difficult because sex is not something that we generally routinely have conversations about. It's been something that whether you're heterosexual or LGBTQIA plus has been somewhat kept in the closet. And as we're in Pride Month, I encourage people to come out of the closet and talk about sex. But for those individuals who do have an orientation that is not heterosexual, there are higher and there are greater stigmas attached to that type of sex. Individuals may also experience stigma related to gender identity. So if you're someone who is non-binary, who is gender non-conforming, who is a person of trans experience, you may also be experiencing stigma related to that as well as your orientation. When we think about STIs, we have for a long time talked really negatively about STIs. And just to give you an example, for anybody who has used or has heard of online geosocial dating applications like Grindr or Jacked, there are words that many people on those sites use that don't really reflect who people are. And so we sometimes you may come across a profile that says, I need you to be height, weight proportionate, I need you to be fit, and I also need you to be clean. But what's being said implicitly in that is that people who are not STI or who are people who are not living with HIV or people who are not living with STIs are dirty. And that is not helpful for the discourse around stigma, around STIs. It's also something that, again, puts more stigma on them and more shame on them for things that, again, are sometimes out of their control. And it leads to people being talked about, gossiped about, excluded from social activities based on perceived sexuality or lifestyle, based on the things that they do. We know that STIs are really common. They continue to rise in Philly. They continue to rise in many places across the country. And so it's really important that we, instead of demonizing STIs as being something that is disgusting or not normative, that we really embrace the conversation around saying many people are going to have an STI at some point in time. How do we ensure that you know how to treat it, that you know where to go for healthcare, and that the places that you're going for healthcare are really going to really wrap themselves around you and ensure that, one, you get the care that you need, but two, we figure how do we prevent additional STIs and HIV in the future. And it also leads to people not being treated with respect, and as previously mentioned, potentially physical violence. So what is HIV stigma? Many of us have been familiar with this, but I just want to level set. HIV stigma is a type of sexual stigma that refers to unfair and negative beliefs, feelings, or attitudes about people who have a higher chance of contracting HIV or for those who already have it. When we think about the early days of PrEP, there were many stories, many stigmas going around about people who were trying to engage with this prevention modality, about them being whores or sexually lascivious, and thus people who did not want that mark of shame put on them did not necessarily engage with it, particularly if they were also experiencing additional levels of stigma. And as we all are familiar with, HIV stigma has been rooted in our history for the past 40 years or so. And it's really based in outdated beliefs, myths, misinformation about how the HIV epidemic began, who those people are, what they do, and how they should be treated. In the early years, public fear led many states to pass laws that criminalized people who were living with HIV for not disclosing their status, including Pennsylvania. So we live in a state, many of us, unless you're coming from somewhere else, many people live in states where HIV continues to be criminalized. In fact, there are about 37 states that continue to criminalize people who are living with HIV, regardless of the new science and technology that tells us that undetectable equals untransmittable. Those things are still not protection necessarily from some of the laws in some states. So I encourage you to really figure out what are the laws around your states, what are the protections that you have that you can provide to clients, because this is still a very real thing. Any stigmatizing laws are still in effect, and in stark contrast to other disease states, such as hepatitis C, hepatitis B, which can also be transmitted sexually. And so it really is a way, or was a way, for states to try to control people who were living with HIV, and control the sex lives that they were having. And then if they, again, didn't disclose their HIV status, they were subject to many types of harsh penalties. And again, despite major advances in treatment, despite advances in PrEP, the high levels of stigma and prejudice associated with HIV continue to pose challenges for people who are living with HIV today. In Pennsylvania, one of the things that I've been taught recently, I won't say recently, but in the past couple of years, is that sex workers who are living in Pennsylvania who are living with HIV, who know their status, can be essentially locked up for that. And so if you are engaging in that type of work, it's really kind of sometimes unsafe to get tested. So things that like HIV laws that are on the books prevent people from actually going to get tested, because there are certain consequences for doing your job and also knowing certain things about your health. As I said earlier, we will talk a little bit about PrEP stigma. So PrEP stigma is a type of sexual stigma that refers to negative attitudes and beliefs of people who take PrEP or people who want to take PrEP. Just to be clear about what it means, PrEP means taking a medication every day before being exposed to HIV to help reduce the risk of getting HIV. We do encourage that people use PrEP as part of a full prevention package, which is inclusive of condoms. We do recognize that that is not always the reality for somebody, but we encourage that as part of a comprehensive package. And PrEP stigma can result from the belief that people will have riskier and more sex partners. The truth of the matter is the science didn't tell us that, right? Since the beginning and early days of PrEP, the science never indicated to us that people who were using PrEP were going to discontinue condom use at higher rates than other folks, that they were going to go out and have more sex partners. We just didn't get that from the data, from the information. And it's one of the main barriers that prevent people from taking and sticking to PrEP, right? The idea of having what some people think of as an HIV medication on your nightstand or in your medicine cabinet, because we know people can be nosy, prevents people from housing things in certain places, and as such prevents them from even getting it. We encourage you to talk to your healthcare provider if you have questions or concerns about PrEP. The landscape for this is ever changing, but it is one of the tools in the toolbox that is able to help reduce new HIV infections. It's also one of the tools that I like to say helps people live their sexual lives that they really want to live. So how does stigma impact underrepresented groups? So here in the United States, many underrepresented groups face discrimination based on any number of things: socioeconomic status, gender, race, ethnicity, class, income, education, culture, as mentioned earlier. And many of these groups are also disproportionately affected by HIV and other STIs, which means they're at greater risk for getting them. As many of you may be aware, young people in this country are the highest risk group for contracting HIV and new STIs. They're also one of the risk groups that have some of the least amount of information about how to best protect themselves and also how to have a conversation around sex, particularly those young people who are non-binary, young people who identify, who are, of Black, Latin, or Asian ethnic status. Many of these young people aren't getting the information that they need. And discrimination may intersect and worsen the sexual stigma that these underrepresented communities experience. I also want to lean into women here as an underrepresented group, because women are also not often a part of the conversation around stigma and PrEP. This is a modality and tool that is available to men, women, persons with trans experience, gender non-binary folks. And we understand that there are many stigmas that affect all of these individuals at many times. So it's really important that we lean into talking to our healthcare providers about ways in which we can engage with this the best and reduce stigma. The other thing that's really important to do, because unfortunately stigma is probably not going anywhere anytime soon, is to figure out how do we cope with stigma. There are a number of things that many people engage in that are what we would consider less than great coping measures, i.e., increasing substance use or binge drinking, things of that nature. But we encourage that people find supportive and sympathetic family, friends, coworkers, people that they trust. Social support groups are really key to helping people figure out how do they navigate what's going to be best and next for them. It can help to lessen the impact and hurtfulness of stigma and discrimination and help you feel less alone. As mentioned earlier, stigma can lead to isolation, and isolation does not lead to good health outcomes. And so we want people to feel embraced by a community and to find their tribe, right? And tribes can occur online. We've been in an era of virtual everything for the past year and a half. So if you find online tribes of gamers, of people who like drag race, of people who are also living with HIV or of trans experience, where you share commonality, create and nourish that tribe, because those are people who hopefully are going to be there to help you at the end. We want to address and cope with and overcome stigma, but we have to do that both on the individual, interpersonal, organizational, and institutional and community levels, and most importantly, on a public policy level. A lot of us think about addressing about addressing stigma specifically within our community, but really and truly, unless we are able to change and shape policy, stigma is going to continue to be around, because there will always continue to be policies that prevent people from accessing healthcare, that prevent people from accessing mental health services or PrEP or anything of that nature. So we have to figure out, how do we change policy to make policy equitable for everyone? Things to consider when taking action against stigma. The first and most important is, do you feel safe? There are times, particularly for many of us who work at institutions, where talking about stigma is not a safe thing to bring up. So you may see stigmatizing behaviors, you may be actively being stigmatized against. However, bringing that up to whomever may cause you to lose your job, it may cause you to be excluded from certain things. So the first thing we want to think about is this particular act of talking about this to someone else going to be safe? And how might it affect you? What is this going to do for life? Do you feel nervous about what might happen? Again, could you lose your job? Could you lose the chance for a raise or employment? Could you lose the opportunity for housing, or having your sexual orientation exposed or being outed, or physically or verbally attacked? So I encourage people to take stock of these things. The other thing that I will say that's not here is to document. Right. So when we see stigma happening either to ourselves or to our colleagues and counterparts, document things that happen, and then hopefully, or maybe it will give you some sort of leverage to feel a bit safer about speaking up, because you will then be able to point to specific actions. Think about how you're going to take action, speak up. You could do it by the phone, you could write a letter, send an email, carrier pigeon. There are tons of ways to speak up about it. But first, again, and most importantly, is do you feel safe doing it? And then, are there other people, coworkers, friends, who will join forces with you? Can you create a little anti-stigma coalition? We like to say now that it's not enough to be to say that you're not a homophobe or transphobic. You have to be actively anti-racist or actively anti-homophobia. And so when we see these things happening, it's important that we create coalitions of people who are going to also support us in those things to really take on the challenge of dismantling stigma. And if you encounter stigma in the healthcare setting, do you feel comfortable talking about it to your provider? And are you prepared to move on to another one if the situation doesn't improve? And that second question is really important. A lot of people live in places where finding a high quality healthcare provider isn't really accessible. In the age of teleprep, some things are maybe a bit easier to find. Maybe it's easier to now find a doctor who's able to do things with you virtually. But this is a really important question: is if you raise this situation to your provider, and your provider does not respond the way you want, do you feel like you can move on to another provider? I like to say you're paying that person for a service, and you deserve the highest quality healthcare for that service. And so I encourage people, if you don't have a provider, to try your best to find one who really supports you, who acts as your partner in your healthcare. Your provider is your wingman, or your wing person, in your healthcare journey. You are the pilot, and so you need to feel comfortable driving your own plane. There are some other steps you can take to cope with internal stigma. And it's really think about the negative beliefs you have about yourself and ask yourself, is this really true? What is the narrative that I've created about myself? What is the narrative that I've let other people create about me? And is this really true? Is this how I should feel about myself? For the people who love me, is this how they feel about me? We don't want this to create self-doubt or shame. We encourage people to find a therapist or counselor. I, as someone I was anti mental health for a long time. I am a firm believer that all of us now needs to figure out how do we talk to a therapist or a counselor about anything, right? Like you could have a trash day. Who are you going to talk to about that? You could be experiencing stigma or, coming out issues. And how do you find a sounding board who's going to help you through those negative thoughts and feelings you can have about yourself? So mental health should be a top priority for all of us in healthcare. Seek support from family, friends, and other people you trust. The one thing I'll say or lean into with family is family can also be created. A lot of us come from places where our families may have not respected us or may have put us out or treated us very differently. So those people who are our parental figures or brothers and sisters, nieces may not be family. And so in the spirit of things like ballroom or other cultures, create your own family. And that is one of the things that I think is really, really helpful, is figuring out who those people are that you can lean into as if they were your brothers and sisters. Joining a support group is really helpful. Again, having people who are experiencing some of the same things that you're experiencing and talking through that can be very helpful. Again, your healthcare provider should be your partner. Again, if you don't have a person who is your partner in your healthcare, try and find another one. There are a number of resources available to help people find LGBTQIA plus healthcare providers. I'm a person who has had the same healthcare provider for about 10 years now, primarily because that person is Black and gay. And I wanted a black gay doctor. So I made it a point to go find a Black gay doctor. If there are all sorts of providers, particularly now that we live in an era where telehealth is becoming more readily accessible. If you want a doctor who looks like you, who speaks your language, go find a doctor who looks like you and speaks your language. But really educate yourself and keep yourself informed about the things. The landscape of healthcare, of HIV, of mental health, of physical health, of queerness is constantly changing. And so it's important that we educate ourselves and keep ourselves informed, because one of the things we don't want to do is be on the wrong side of history. We don't want to be on the wrong side of stigma, thinking that we're doing things that are supposed to reduce stigma, but ultimately are reinforcing stigma for people. Again, if you're going to address external stigma, make sure you feel safe doing so. If possible, speak out to correct myths. There are things people say all the time that we know are just false or inaccurate or scientifically, nuts. Speak out about them if you're able to, about the myths, the stereotypes, the false information, particularly if it prevents you from staying physically, mentally, and sexually healthy. Use words that are affirming and supportive. Obviously, avoid words that are judgmental and stigmatizing. One of the resources that Gilead that we've created that I'm happy to share with people is it's a sort of person first language list. And so we've created some things that people have said that we wanted to course correct, and that we also say, like we're not perfect, that we want to course correct within ourselves as we're on our journey of continuing to evolve, that really help us talk differently about people who are of different sexual orientations, different genders, different STI statuses. We wanted to make sure that we were able to create that resource, and we are happy to provide it. And educate yourself and others about what people can do to take care of all aspects of their health, including in particular their sexual health. On an organizational level, stigma can be found everywhere, as we mentioned, even in healthcare settings. And so it's important that you speak up if possible. If you think they're engaging in stigmatizing behaviors or discriminatory acts, and that make other people, including yourself, feel uncomfortable. There are a number of advocacy groups that exist right here in Philadelphia, that exist across the country, where you can join forces with other people for support and leverage to seek guidance from them, and in some cases, legal services from them if you need to, particularly those organizations that are committed to social change. And social change and also social equity. If you don't feel it's safe, perhaps there are other ways you can take action. maybe you can remove yourself from the situation and find an alternative, such as switching to a more understanding healthcare provider or a different organization. I think that it's really important that we try to challenge the system as much as we can. And this is, in some ways, maybe a last resort. However, if safety is a concern, maybe this is the best option. So just really think through what makes the most sense for me to challenge the system, or should I remove myself from the system? And then what can be done about the stigmatization of PrEP? So PrEP stigma, like all forms of stigma, is rooted in some really old beliefs and fears. So we want people to talk openly about sexual health, including PrEP, including STIs, including the type of sex that they're having, so they can feel good about themselves. They can feel good about taking care of their sexual health. And we want to normalize the subject. We want to remove some of the misconceptions about who PrEP users are, what they engage in, and just really normalize HIV testing and PrEP being the outcome. You can take steps to educate yourself and others about PrEP and the importance of staying sexually healthy, as well as about the importance of things like U equals U or undetectable equals untransmittable, and how PrEP and U equals U really come together for us to be supported as an entire community. And through the words that we use, we can really work together to start to end stigma in the many forms that it takes. So I'll leave you all with some what we hope are helpful resources. One is HIV.gov. There's a specific stigma topic, as well as the Centers for Disease Control and Prevention has specific stigma topics, and their Let's Stop HIV Together space. Planned Parenthood has a number of things, resources related to stigma. And as we think through mental health, NAMI, or the National Alliance on Mental Health, is a really great resource for stigma, for some conversations related to mental health and stigma. And SAMHSA, or the Substance Use and Mental Health Services Administration, has a number of resources for people who are engaging with substance use and trying to mitigate stigma in that particular arena. So I'll pause here, and I will open it up to Q&A. If you would like these resources, or if you'd like, if you are not necessarily in Philadelphia and you want to have this resource also delivered to your agency, I'm happy to connect you to the people who are able to do this in your various geographies. But if there are questions, I'm happy to take them now.
Thank you, Blake, for that powerful presentation. Actually, I was sitting here taking notes myself and overwhelmed with deep appreciation of this topic, because it still is an issue, stigma, right? I think of it, this year marks 40 years of HIV/AIDS, and we're still experiencing the stigma despite all of the advancement in treatment. And so thank you so much for that thorough presentation and the definition and identifying underrepresented populations. So thank you for that. So let's look in our Q&A box. If you have any questions, please feel free to ask your questions. So there was a question about, do you happen to have a link handy, or a Nova link that could direct folks to Black and gay therapists in Philadelphia?
I can actually, interestingly enough, I was looking for a Black gay therapist not too long ago in Philadelphia. So if you give me like 2 minutes, if you want to stay on, I'm happy to look for that, because I was just looking for one recently, and there was a really great organization that I saw. So give me 2.5 seconds.
Okay, 2.5 seconds. If you have any other questions, please feel free to ask your questions in the Q&A box below.
So if you go to Psychology Today, psychologytoday.com, and just type in Philadelphia, Psychology Today will pull up a list of queer therapists, and you can also, I think you can not only segregate, you can parse those people out by race, by gender, by license, and all of that thing, and all of that. There's also a really great therapy organization in Rittenhouse that is primarily LGBT person of color. I won't specifically say Black, but they do have, I would say, maybe 4 or 5 queer Black therapists.
Okay, thank you.
Mm-hmm.
There was also a question specific to your PowerPoint presentation. Are you willing to share that, or do you have a modified version of your slides that we can share with our attendees?
So if you would like the slides, I'm happy to figure out how we get that to you. My email is blake.rowley@gilead.com. And if you reach out to me, I can probably I can PDF the slides and email them to you.
Or what you could do is maybe just send them to myself or Kyle, and we can just send an email to all of the attendees on this webinar. That way we can just do one email blast.
Okay. I will, let me double check with my business conduct and make sure that that's something I can do. But I think that should be okay.
Okay. So we do have a few questions. Someone says, I work in a mental health hospital. There is an HIV positive patient here. He apparently has more than one partner, one of whom is now pregnant by him. How do I support him while also addressing the risk he may be taking and the people he is putting at risk?
That is a great question. And I'll be honest, I may not be qualified to answer that. I think one of the things that's really important is to one, assess what his treatment needs are, or if he's currently utilizing treatment, and then also to have him inform his partner, if possible, around pre-exposure prophylaxis. Many women just don't know about PrEP and that it's a possibility or an option for them. And particularly if he has a partner who is pregnant, or if he's trying to have children, or if she's trying to have children as well, it's important that they know really as a team what their treatment and prevention options are. So I would probably try to encourage him to talk to a medical professional, a doctor if possible, and just to get a better understanding of what his current level of knowledge is around HIV transmission, and how he can best support and protect himself and his partners.
Thank you, Blake. Another question is, how can we as future advocates create a system that will change or challenge those policies that prevent underrepresented groups from accessing high quality healthcare due to stigmatization?
Great question. I think, one of the things that was really powerful are the days of ACT UP. And so I think taking a page out of out of their playbook and not being afraid to challenge the system. They literally went to places like the White House and, threw blood on the lawns and stood out there and camped out. So I think creating coalition, figuring out how you build power is extremely important, and really making sure that you know who your congresspeople are, you know who your senators are. Don't be afraid to write those people letters about things that you're experiencing. Don't be afraid to go to the Capitol or to go to City Hall here in Philadelphia and stand at their door until they see you, because their job is to really serve you and to figure out how do they create policies that make it possible for you to live your best life. And so I think the important is build coalition. Don't be afraid to challenge the system. And honestly, as future advocates, I think young people have been extremely instrumental. Young people are changing this world every day. So I encourage young people to just use your voice, understand and own the power that you have, and make it happen.
Thank you. Another question is, have there been any grassroots efforts by community folks in PA to compile a list of LGBTQ people of color owned run businesses and organizations?
I think the Black and Brown Workers Collective out of Philadelphia may have something related to that. I know that they've done a lot of leveraging of their power to try and get systems or places that are have had a history of discrimination, whether they be healthcare organizations or businesses, to really support them. So I would look into the Black and Brown Workers Collective and see if they're able to provide resources related to that. Also, I will say as a plug, the new executive director at Galay, her name is Ashley Coleman, is a really great and powerful advocate in the Philadelphia area. And I'm sure she has a really good handle on some of the Black and Brown LGBTQ POC businesses and organizations in the area.
Okay, thank you. Someone else wanted to say thank you for presenting this presentation, but also acknowledging women that are underrepresented. And I want to kind of piggyback off that, because oftentimes, specifically cis Black women, we feel invisible. as a woman of color, but also HIV positive, you see it all the time. And so I don't know if you're familiar with Billy Porter's role in Pose.
Yeah.
There was an the last episode he talked about his HIV. In the movie that he came out to his family, but in real life he spoke about in interviews and articles that the stigma is still prevalent, specifically, just
Mm-hmm.
especially with the Black community. And there was some commentary made specifically from cis women of color saying, hey, but that's great for you, but
What
the
about?
comment was HIV looks like this now, but for whom?
Mm-hmm.
So I think there's a lot of conversation needs to be had, maybe another training specific for cis women, because a lot of us are unaware of PrEP.
Mm-hmm.
Information is not in the communities that we have access to, and we are one of the highest underrepresented group of people with HIV.
Yes. I think for me, women have always been, it's always been really important to talk and to bring women into the room. And this is just personally, Black women have been my rock for my entire life. And then Black women, and I think women in general, Latinx women are often the bedrocks of our community. And then they're often the women, the sort of group that we think about the least when we, design and build interventions and we create excuses around why we don't have things for women. So I think it's important to have intentional conversations with women that are led by women that really support them. Gilead does have presentations related to sort of HIV in women, and I'm happy to sort of have that conversation with individuals. But I also want to make sure that I'm also very cognizant as a cisgender male that I provide space for women to really lead that conversation, because I think that we get into the room and we take up space, and it's not our place to take space.
Yeah. So thank you for that response and to that question that was asked. Another question is how to explain to a patient that their behavior is considered high risk and therefore they would benefit from PrEP. The common response is often, oh, I don't need that.
Mm. We at Gilead are actually challenged with this question as well. We've learned recently that people don't quite understand risk, and that words in terms like high risk or at higher vulnerability for HIV don't resonate with a lot of people. I'm a former epidemiologist, so I like to lean into data, particularly data related to young people as well as persons of color. The data just say that for Black men, there's a 1 in 2 chance of contracting HIV if we don't do something, right? And so while you may necessarily not see your behavior as quote risky, what the information tells us is that there is a risk pool there that you need to be aware of. And so how do we do our job to ensure that you don't fall, that you don't seroconvert, right? And one sexual activity can lead to a host of things. And what we do know from the data is that you can be in a monogamous relationship, and that is actually the place where we see some of the highest transmissions as people who believe themselves to be in monogamous relationships. So it's really trying to dig at the root of what people don't think that their risk is and help them figure out that there is risk, by the virtue of the zip code you live in, who you choose to have sex with in the 19107 area code is a risk.
Thank you for that. Another question that came in, what are some ways that I, as a cisgender white male, can better support and ally with people experiencing intersectionalities of stigma? Where should I start?
Whew. I would say the best place to start is to listen to people's experiences and to listen to understand and not to respond, and let Black women tell you how they want to be supported by you. Let trans folks tell you how they want to be supported by you. I think a lot of times, and I'm guilty of this in my past and probably to some extent today, we come into conversations with agendas around how we think we should support people and what we think that they need. And it's important that we let people tell us what they need and provide space to make those things happen for them.
Mm-hmm. Thank you for that. Another comment, someone says, I have been HIV positive since 1986 and have been doing a support group, Pause Light, through my church here. What I found with you guys coming in is the stigma happening within the family and how to navigate wellness emotionally through that.
That's a challenge. I think, to continue to experience familial stigma related to HIV in 2021 is heartbreaking. There are far too many shows, far too much information to continue to have that be a reality for particularly our young people, but really anybody who is newly diagnosed or has been diagnosed for a while. Um, I don't have a great answer except to continue doing what you're doing and providing them, support and space. I think one of the things we hope is that people's families will come around. Sometimes that happens, and sometimes that doesn't. What we have also tried to do sometimes at Gilead is create space where we talk with, patients and support groups, and sometimes that does include family members about the truth about HIV and about PrEP and how you can support those people in your life who are living with HIV, because we all know somebody, and sometimes that person is in the bedroom next to you, and it's important that if you're their caretaker, you should, regardless of what you think, really provide them with care and love and support.
Thank you for that. This next is a question. Can you provide this stigma training webinar to our staff once COVID-19 restrictions have been fully lifted? I think this will be beneficial to all my colleagues. And I agree. I think that this is a powerful presentation. So you are being asked to do this again.
I am happy to do that. Again, just reach out to me. My email is Blake, BLAKE, period, Rowley, ROWLEY, at Gilead, GILEAD.com. And I'm happy to figure out how we make this happen for you and your organization once, COVID has been fully lifted in Philadelphia. I think that's today. It may be the 11th. So we can get started on planning that as soon as possible.
Okay. And the person who asked this question, I have their email, so I can send them your information so that you guys can have more conversation around this question. The next comment or question, PrEP is great. PrEP is great, is a great tool to having in our toolbox, but youth 18 and up may not see their risk factors. Having some, I guess, beginnings of communications with them on the benefits of PrEP is a prevention too. So I guess we're just stating that having conversations
Mm-hmm.
is a start to helping them put into a toolbox. Any thoughts
Yeah.
about that?
Again, I would lean into the data in Philadelphia. Individuals who are ages 13 to 24 continue to experience some of the highest rates of new STIs, and any healthcare provider will tell you that STIs kind of travel as a family. So if gonorrhea is present, it's not uncommon for chlamydia to be present, or for syphilis or HIV to be nearby. And as young people, as you start to explore your sexual life and your sexual appetites, it's important that you understand what all of your prevention tools are going to be. So I agree. It's a very difficult thing for young people to understand, and we're trying to figure out again how we help young people understand that PrEP is a possibility for them, and how do we help them access it as well.
Okay, thank you. Any other questions in the audience? So that was the last question. If you have any other questions, feel free to ask. Um, but in the meantime, in the Q&A was also many thank yous for your presentation.
Thank you.
It was awesome. And so that's good to know. I think the ideology behind having this summit every year is to provide educational information, to empower individuals to walk away to have learned something about a topic. Okay, so we have a few comments. Are there any health risks with PrEP?
So there are some potential side effects with PrEP. If you would like to chat more about health, there are no major health risks associated with PrEP that we've seen. But there are potential. It's medication just like anything else. There are potential health risks associated with PrEP. But again, in the sort of past 10 years or so that we've been utilizing PrEP, the health risks that we've seen have not been great.
Okay. So that was the last question. Again, people are chiming in saying, great presentation. Thank you so much for sharing. And so, great. And so if there isn't anything else, do you have any last words you have, Blake, before we close out today's webinar?
No, thank you. This was awesome. Again, if you want to get in touch with me, I provided my email address, and also if you live in a different geography other than Philadelphia, I'm happy to connect you with the community liaison in your geography who's able to do this for you as well. I cover Philadelphia and Delaware, but there are 26 of us across the country who are really trying to continue to provide education, support, and resources to people living with HIV, to people who are potentially at risk for HIV, to LGBTQ communities, Black people, Brown people, women, persons of trans experience. We're really trying to just boots to the ground and really spread information as much as we can so that we can actualize the best health outcomes for all of us.
Great. And for those of you who missed his email, feel free to reach out to the Community Health Training Alliance. We will provide you with his contact information. And once we receive the slides from today, you all will receive those slides as well. So thank you again, Blake, for your presentation. I definitely learned something. It gave me food for thought to think about even internal stigma that I think many people who are living with HIV experience,
Mhm.
but also looking at external stigma and all things stigma. So thank you for all of those definitions and insights you provided. Um, and so before we close out, those of you who are still on, when we close out this webinar, you will be prompted to complete a survey. So be sure to hang on and complete the survey. We definitely want to hear from you and your thoughts about today's presentation. And so without further ado, we're going to close out. You all have a great rest of your day. Thank you again, Blake, and
Thank
take care.
you. Take
Bye.